Hello, everyone, and welcome to a pre-recorded Success Instagram Live. Today I have Devon with me. She is one of our occupational therapists here. So what are we going to talk about today, Devon?
So today our topic is our specialty therapies here, what we have to offer at Success. I'm going to be speaking more just about the physical rehab therapies, most specifically PT/OT speech, pertaining more so to concussion or mild TBI.
Awesome. That sounds good. Yeah. Well, for those watching, they may not be familiar with some of the therapies that we offer here. So if you wouldn't mind getting started on that,
Sure.
That'd be great.
Yeah. So the three major physical rehab therapies we have here are physical therapy, occupational therapy, and speech therapy. So most of you, I'm sure, are very familiar with physical therapy. That's kind of the one you hear about the most. However, different types of therapy are handled differently for each different kind of population or clientele that you're dealing with. So here we really, focus a lot on, neuro-based therapy, especially those like for our clients that have concussions that come in. So, with PT, it really focuses a lot on that dynamic balance component, integrating different senses. If you watched our previous live, or actually the podcast, we really talked about signs and symptoms of concussion and post-concussive syndrome. And, ways to manage that. And one of the ways is quick identification of issues that you might be having and then seeking therapy for that, which would be, PT, OT, or speech, depending on what symptoms you're having. So, with physical therapy, it's really focused on looking at the different symptoms and how they're affecting your life, as well as it goes for occupational therapy and speech therapy too. So we really look at each person's individualized goals and their roles prior to their injury and working towards a comprehensive program to get them back to leading a meaningful life. So we utilize all sorts of different types of technology, which in the next segment, we'll talk more in detail about some of those different tools that we use just to enhance function for our clients and to reduce symptoms, if not resolve them completely, because they can be so disruptive to everyday life.
And I'm sure there are, individuals too that don't even necessarily need all of these therapies.
Exactly. Mm-hmm.
So like someone may come and, they need PT, but others may not.
Exactly.
Right? Okay.
Exactly. Yep. So you might not necessarily need all three. The individual might be experiencing just maybe some high-level balance issues that our physical therapist can work closely with the client on to maximize those and to resolve those to the best of the individual's ability. We look at different vestibular skills, and we have some different technology to assess the deficit areas and then treat accordingly for those. We also offer equestrian or hippotherapy here, which is awesome. So we do have a physical therapist who completes that for our clients, which is a huge benefit because it works on so many different things. And we're working actually on integrating OT there as well.
That's awesome.
Yeah.
And it's nice to get outside a different different on things too, not just having PT or OT inside, you're going outside. And I know a lot of our clients love going to equestrian.
And and speaking towards like an OT, occupational therapy mindset, being in a functional environment, is so much different than being in a simulated environment. So a lot of times we can work on certain things in the clinic, and the client will do very well. However, then we translate it out into, real world. And there's a lot of different external stimuli, noises, unanticipated events that can really throw a curve into things that can really exacerbate symptoms. So, before somebody's discharged, from our care and from our therapy services, we want to make sure that we really thoroughly look at all the different contexts that we're doing things, because we want the person to be able to successfully return to as many, if not all, of the roles that they were doing before. Speaking more towards the concussion treatment side of things. We also, with occupational therapy, we really work on individualized treatment programs and plans of care for all of our clients, and we look at daily life skills. So if a client comes in and is meeting with us and they're having difficulty, through a particular part of the day, or if they're multitasking, or if they have children and trying to manage a job and their symptoms are really interfering with that, we try to break that down and look to what is the root cause of that, and oftentimes it's multiple things. So then we can work together with our team to address those treatment goals comprehensively, which is really nice, because that repetition sometimes is what is needed to help integrate, those symptoms that person might be having, whether they're visual, vestibular, balance, affecting their balance, or even processing of how to do things. We work on each of those things individually in our individual treatment sessions, but then also within PT and OT and speech, we overlap a lot, which is very important for that continuity and progression of the rehab process. So we can really work on maximizing that person's benefit to address the deficits quicker and with a higher frequency to help reduce the symptoms and the negative, like the adverse reactions that they may be experiencing after their concussion in their real life. With that being said, with speech therapy, we have a speech therapist here, and she really works a lot on, word finding skills and memory, organization, problem solving, planning and strategies and things like that oftentimes are second nature to us, but then after an injury, we don't realize the impact that, how that recall just kind of happens for us. After an injury, you have to really think about it, and things can be very overwhelming, especially if it's not black or white, if there's a gray area in there. So, speech will talk to us about, what functionally that person has to do. And then in their sessions, if they're having trouble with a PT or OT task, we can talk to the speech therapist, and she'll really work on breaking that down too in her sessions.
So that's great. So
yeah.
you guys kind of all work together.
Yes.
That's awesome.
Yes.
That's awesome.
And, really work on breaking and coming up with strategies initially with how to accomplish a task with possible strategies. And then as the person continues to recover, scaling back on those strategies a bit. But it's nice because any lingering symptoms that a person might have, they may be functioning at like 95%, but they still have some residual side effects of their injury. Our goal then too is to have them establish like a toolkit, for lack of a better words. So an exercise program or strategies that they have written down or in a binder that they can refer to, to help them process and to help them continue forward with their recovery.
That's great.
Yeah. So, the biggest thing that I kind of want to express is recovery from a concussion, brain injury, mild TBI. It's not linear. unfortunately. You know, there's a lot of components that happen. You know, you'll see people take 2 steps forward, 1 step back, but it's not just one discipline.
It's all a part of the process of recovery.
Exactly. And we really work together as a team. And we have a wonderful team. I'm just speaking towards like on behalf of the physical rehab team today with PT, OT, and speech. But we have multiple other therapies here. And we all work together cohesively in a very interdisciplinary model that, you know, we work together to best serve the clients and to maximize their rehab benefit and their ability to recover.
Absolutely. I know in cognitive rehab therapy, you know, I've worked with, you know, you or just some other therapists, you know, just kind of to blend everything together to kind of just maximize, you know, their recovery process. So.
Right. And it's interesting too, because, you know, we'll have some clients that come to see us and they might not necessarily start with all 3, PT, OT, and speech, like you were speaking about before, Janelle. And then as they continue to come and, you know, say they're set up with PT and they're working on higher level balance things or vestibular therapy, and the physical therapist is noticing that, you know, the person is having trouble with their vision, or there's a component with their vision, or they're having a lot of trouble following just like 2-step commands, then that physical therapist can refer the client to PT or speech.
That's great.
So, you know, just having that ability, you know, and within our organization to be able to do that is so important. To have therapists skilled enough to recognize that, and then to have the therapy right here, you know, to really maximize that person's recovery, I think is super beneficial and important too.
Absolutely.
So in our next segment, you know, we're going to be kind of continuing with this chat about PTOT and speech, and kind of talking more about like specialized equipment that we have here that we can offer, more so pertaining to, again, the concussion and mild TBI diagnosis, that, you know, we'll continue that conversation in the future.
If you have any questions for Devon or her team, please be sure to leave a comment in this video and we can have Devon or her team address it in a later series or an episode. But thank you for sitting down with me today,
thanks.
Devon, and talking about all of the great services Success provides. Wink, wink. And can't wait to have you sit down with me again.
Absolutely. I'm so excited. Thank you so much, everybody.